This recorded lecture will go over the LPN scope of practice in Florida and provide links to find this information if you desire to do so. The 2022 Florida Statute, Chapter 464, goes over some statutes for the licensed practical nurse and registered nurses within Florida. A licensed practical nurse means any person licensed in this state or holding an active multi-state license under Statute 464.0095 to practice practical nursing. The practice of practical nursing means the performance of selected acts. This includes the administration of treatment and medications in the care of the ill, injured, or infirm, the promotion of wellness, maintenance of health, and prevention of illness of others under the direction of a registered nurse, a licensed physician, a licensed osteopathic physician, a licensed pediatric physician, or a licensed dentist, and the teaching of general principles of health and wellness to the public and to students other than nursing students. A practical nurse is responsible and accountable for making decisions that are based upon the individual's educational preparation and experience in nursing. A multi-state license means a license to practice as a registered nurse or a licensed practical or vocational nurse issued by a home state licensing board, which then authorizes the licensed nurse to practice in all party states under a multi-state licensure privilege. A multi-state licensure privilege means a legal authorization associated with a multi-state license that permits the practice of nursing either as an RN or an LPN/VN in a remote state. A nurse means an RN or an LPN/VN, as those terms are defined by each party state's practice laws. What that means is that each state can have different qualifications or duties of the registered nurse or the licensed practical nurse. This is one of the reasons why it's so important to look up your Florida state, or not your Florida, but to look up your state statutes in each state that you plan to practice in so that you know what is technically legally allowed in each state. Violating any of these acts or doing something more than you are technically licensed and authorized to do would be a legal infraction and could have severe legal consequences. This information can all be found if you click on this link, the link that is bulleted here, Statutes and Constitution, to view the statutes of the online Sunshine State. And that'll take you to the entire Chapter 464, which goes over various duties and authorizations of the registered nurse and the licensed practical nurse. According to the 2021 Florida Statute 464, so this is a little bit of an older version, this says that the licensed practical nurse is any person licensed in Florida to practice practical nursing. Florida statutes define practical nursing as the performance of selected acts, including the administration of treatments and medications in the care of the ill, injured, or infirm, and the promotion of wellness, maintenance of health, and prevention of illness of others under the direction of a registered nurse, a licensed physician, a licensed osteopathic physician, a licensed pediatric physician, or a licensed dentist. This is noted in Section 464.003B of the Florida statutes. Now, the only difference, you notice that was extremely similar to what I just read. The only difference is that this is the older version, and the previous version that we just went over that had the actual link that you can click on to access that direct information is the current version. So making sure that we always stay current, notice how only a few words were different, but sometimes a few words can make a big difference. That's one of the reasons why it's important within each state that you're in to always check the most current statute for that state according to how you can practice as a nurse. This goes over the Florida Administrative Code, Rule Chapter 64B9-12. Now, if you click on this link over here in the dark gray area to the left-hand side, it'll take you to the full code register, which will show you all of the different aspects up here that you can see, the statement of intent and purpose, definitions that are referenced, the aspects of intravenous therapy outside the scope of practice of the LPN, the authority for the LPN to administer limited forms of IV therapy, the competency and knowledge requirements that are necessary to qualify the LPN to administer IV therapy, and the effective date of this chapter. Now, before I go on and read what it says in this actual chapter, I think it's important to note that it says competency and knowledge requirements that are necessary to qualify the LPN to administer IV therapy. This is one of the biggest reasons why in nursing school for the LPN, we do not practice any type of IV therapy within the clinical setting. The only place where practice and learning of IV therapy procedures are appropriate is within the simulation setting on campus. It is actually illegal for the LPN nursing student to practice IV therapy within a hospital or any type of healthcare clinical setting. This is very important for you to note because this means that if you were to do something with the patient's IV, try to administer any type of IV medication, whether that be IV push, IV piggyback, IV fluids, anything according to that nature, it is actually illegal for you to do so, and you could be facing legal consequences for those actions. Now, we go over this a lot more in detail when we actually start clinicals and we prepare to get started with clinicals. But it's very important to note that the LPN cannot actually administer any type of IV therapy with medications until after they have completed a required 30-hour IV therapy course. For our Baycare students who are employed and funded within our LPN team nursing program, you will actually receive the benefit of this course after you graduate from our LPN program. This will be part of your LPN internship and onboarding procedure before we start you on your actual floor to be an LPN. So you will have this 30-hour course free of charge included in your employee onboarding that you will get before you can go onto the floor so that you are legally able to administer IV therapy to your patients. So let's go on and continue to read. Section 64B9-12.003 goes over the aspects of intravenous therapy outside the scope of practice of the LPN. Aspects of intravenous therapy which are outside the scope of practice of the licensed practical nurse, unless under the direct supervision of the registered professional nurse or physician, shall not be performed or initiated by a licensed practical nurse without direct supervision, including the following: initiation of blood and blood products, initiation of administration of cancer chemotherapy, initiation of plasma expanders, initiation or administration of investigational drugs, mixing an IV solution, IV pushes except heparin flushes and saline flushes. Although this rule does limit the scope of practice for the licensed practical nurse, it is appropriate for licensed practical nurses to care for patients receiving such therapy. So what does all this mean? It means that you, as a licensed practical nurse, cannot perform the actions listed from A through F. That means that you cannot initiate blood or blood products. You cannot initiate the administration of cancer chemotherapy. You cannot initiate the administration of plasma expanders. You cannot initiate the administration of investigational drugs. You cannot initiate the mixing of IV solutions, and you cannot initiate the administration of certain IV pushes. But it says in this rule, while you cannot initiate it, you can care for patients receiving that therapy. So what does that really mean? Basically, that means that the RN has to start all of those actions, and then you, as the LPN, can follow up on that care and monitor them. So let's go back and look at blood products. Now, plasma expanders can sometimes be considered a component of blood products. You cannot initiate them. However, you can monitor and discontinue them. Same with the administration of cancer chemotherapy. You can monitor the patient while they are receiving that chemotherapy. Same with the administration of investigational drugs. Now, you're probably thinking to yourself, when am I going to administer an investigational drug? Well, let's go back to our COVID-19 pandemic, where we were administering a lot of drugs that needed to have explicit approval from the FDA for experimental use. One of these Many of these drugs would be given in the ER, and the patient would need to sign a waiver saying that they do agree to receive this drug, even though it's not technically approved by the FDA yet. It is just approved for our emergency use. That would be something that an LPN could not initiate. However, they could monitor the patient after the RN had initiated it. As far as IV pushes, this really depends on the facility that you are working in. For example, within Baycare specifically, we have a list of medications that the LPN can push IV on their own without the direct supervision of the RN. Now, each one of these medications on this specific list, you will receive additional education on. So you'll know exactly what that drug is, what you're looking for, what the side effects are, and any complications that you need to monitor that patient for while you are administering the drug, as well as after you administer that drug. Now, you are only authorized to push these drugs on your own after you have been signed off on that education, as well as signed off on the actual skill of doing so. You could be signed off on the skill of doing so by your unit-specific educator, as well as by a authorized registered nurse on the floor who has been given the permission to sign off patient or nurses on that specific act. For example, a charge nurse or a CN2 or a CN3. So within Baycare, we have a specific list, and you guys will all see this list when you go into your 30-hour IV therapy course. I have the list. If you are curious, you can reach out to me and I can show you. But essentially what it is pretty much all of our antibiotics. You can push and hang. We are limited to that you cannot administer cardiac medications. And generally, you cannot administer any type of advanced cardiac life-saving medication, such as epinephrine or amiodarone, lidocaine, and that's a lot of those are our cardiac medications as well. So that all of that information and more can be found at this link here that is on the far left side. And it's most important not only to check your state statutes to see what you can legally do as a nurse, not just an LPN, even as an RN. As any type of nurse, you want to check your state statutes to see what you can legally do as a nurse. It's also important to check your individual facility policy because, as we mentioned, not only do the states differ a lot in what they allow and they don't allow, but facilities will do this as well. Because as you can see, this information can be interpreted in many different ways, and facilities will use that to interpret it very differently. For example, HCA may have policies that are very different than Baycare policies when it comes to the scope of practice of the LPN and what that LPN can do. Maybe what types of medications they can administer, maybe what types of patients they can care for, and so on and so forth. So the general rule of this entire presentation is always check your state statutes and always check your individual facility policy based on your scope of practice to see what you legally can do.